The 6 NHS regions are without a women's health hub that has been mapped. We're going to look into this exclusive from the iPaper, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from the iPaper with the headline that the 6 NHS regions without a women's health hub has been mapped. The several NHS integrated health care boards have missed the deadline to develop a women's health hub providing all core services by the end of the year. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. It's really important, just like any other healthcare service, that women, just as much as anybody else, are given access to the health that they are needed, rather than it being decided by a postcode lottery, which is unfortunately many women are still in this situation. Now, is this fully down to Labour? No. Can you blame Labour for some of this? Yes. But who really takes the main blame for this? The Conservatives, ultimately, because they're the ones who have been in charge of the healthcare service. So they really need to take the brunt of this. However, what happens between now and the end of this year, obviously, if it's still not being provided, then questions no doubt need to be asked about the Health Secretary Wes Streeting and what he's doing about the health service in England in particular, because this is where it's most particularly, this is about at the health hub, women's health hubs in England, women being able to access the healthcare that they need, whatever that may be. It's really important to them. It should not be a conversation that we are having, but this is a conversation, sadly, that we are having. I've always said that healthcare is a human right. Yes, healthcare does come out of a cost, and it's a cost that we all, as taxpayers, pay into in the UK, and we're very grateful and very lucky to have such a healthcare. Believe me, people in England in particular really don't understand how lucky they are to have such a healthcare system, in stark contrast to other countries. They really don't realise just how lucky we are. Has it lost its way in the last 14 years? Yeah, it's because of a certain political party. But it is still, to have the kind of healthcare that we have, we are very blessed to have it. But my hope is that in this first full year of a Labour government, that we do start to see a change around in fortune when it comes to the healthcare system, and just as much as women's health as it is with any other health system for that matter. So, women face a postcode lottery of access to menopause and sexual health service, with some areas of England lacking a single dedicated women's health hub. The deadline for every NHS Integrated Care Board, ICB, to have at least one hub providing all core service set by NHS England was at the end of December 2024. This has not been met across the country, according to a Freedom of Information data obtained by the iPaper. The Royal College of Obstetricians and Gynaecologists, I'm going to mispronounce the name, so I apologise, the RCOG, so progress towards implementing women's health hubs in every ICB has been frustratingly slow, despite research showing that they improve access to healthcare. Core service of women's health hubs includes menopause, menstrual problems, contraception, pre-contraception care, breast pain, pessary fitting and removal, sexual screening and treatment for sexual transmitted infections, STIs. The previous Conservative government introduced the concept of women's health hubs in 2022, women's health strategy to integrate healthcare services in the community and improve access to care. The hubs are understood as a model of care working across a population and are not necessarily a single physical space. Each ICB receives $595,000 in August last year to establish and or expand at least one in their area, which was allocated until March 2025. The RCOG called for Labour to commit to long-term sustained investment to enable their equitable expansion across England. 3 ICBs, South East London, Lancashire and South Cumbria and Surrey Heartlands, responded to the FRI saying that they do not yet have an official hub offering all 8 core services. This map here is women's health hubs in England, the postcode lottery of women's health service since the 2022 women's health strategy. So you have here in grey at least one physical hub. Red one here, no functioning Women's Health Hub. That's just absolutely disgraceful. No response to the FRI request. Women's Health Hub operating out of existing networks. And Women's Health Hubs to be opened shortly. This is the statistics that they have there. So you have... So Lancashire and South Cumbria, no fully functioning Women's Health Hub there. NHS Black County, no fully functioning Women's Health Hub there. There's even some that you still have it in Southeast London, Southwest London. Southwest London's to have one open shortly there. Surrey Heartlands, no functioning one there. Hampshire and Isle, again, no functioning one there as well. But NHS Devon has one operating out of existing hours there. Bath and North East has at least one. There's quite a good parts. Like there are some parts like North East and North Cumbria's got at least one. At least one in North Humber as well. West Yorkshire there, Lincolnshire there. At least one in Cambridgeshire as well. And then you have the ones with operating out of existing networks. Buckinghamshire, Oxfordshire, Bedfordshire West, Norfolk and Walesey, Suffolk and North East, Warwickshire, Cornwalls and Isle of Man. So it is a mix there in England. I mean, obviously, the ones obviously where there's no functioning one, obviously that needs to change as soon as possible, so that at least there is one there. Cheshire and Merseyside did not respond, so we don't have an answer for them. NHS Somerset there. The other one who didn't respond was NHS North London did not respond as well. That's a very odd one there as well. So, a spokesperson for South East London ICB said, significant development work has taken to support the design of a women's health hub model, and it will be operational in 2025. Surrey Heartland said it already has a service operational, but it does not yet fully meet the NHS service specifications and is looking into expand the offer. South West London said it does not currently have a hub that meets the NHS specifications, but intends to open its first one in December 2024. Well, has it opened or not? Question mark, please. Black County ICB said that rather than creating discrete hubs, physical or otherwise, it is used the funding to identify women's health champions. Ask the public which women's health services are required to improve access to pathways for heavy and measurable bleeding and menopause bleeding. Hampshire and Isle of Wight has called for the terms of Women's Health Hub a misdemeanor, saying that GP practices already provide the best services listed in the national specifications. And the ICB is focused instead on improving access to current services. Focus in Hampshire and the Isle of Wight is to improve access to current services, delivering across the path to ensure all women in Hampshire and Isle of Wight have access to the service, the ICB has said. 16 out of 42 ICBs have set up women's health hubs for existing primary and secondary networks, meaning there is no centralised location, but rather a development of pathways and accessibilities. And the further ICBs have developed at least one physical hub. Of these, 6 said they have developed a one-stop shop, meaning a single venue that provides a wide range of services. This includes BEMs, women's health hubs in NHS Bath and North East Somerset, Swindon and Wiltshire ICBs, which opened in September 24, and provides all of the core services. The hub is run by clinicians with a special interest in women's health and provides a holistic service to the point of care for women's patients throughout their life course, the ICB has said. We support thousands of women, but not many have access to a health hub. Dr. Jane Barsner, President of the Faculty of Sexual and Reproductive Healthcare, the FSRH, said the development of hubs have been patchy across the country, with some ICBs developing really good service and others where nothing appears to be happening. She said even if the areas were going well and needed further development, because if we're really going to get women's health hub of affecting inequalities, they've got to do more than just accept whoever comes along. Dr. Parter, consultant in Barts Health NHS Trust, said the successful women's health hub model is about strengthening collaboration across primary care, secondary care and sexual health. Therefore, centralised physical venue may not be appropriate for a large rural ICB where the majority of the population would struggle to live there. However, she added that there are some areas where the service has been there for ages now and they're calling it a women's health hub. Primary care networks are great for pulling together GPs, pooling resources and everybody learning from each other, she said. But I think if you need to be working with SRH, sexual and reproductive health, and gynecology, you're really going to change the way things happen. Diane Dalzebrick, founder of community group Menopause Support, said Progress has been very mixed, with some areas facing significant barriers due to a lack of ongoing ring-fence funding. We support thousands and thousands of women every year. Now, I have not come across very many who have access to women's health hubs, she said. There is still a postcode lottery of menopause care, with a recent menopause support survey finding that more than 83.5% of women who have been plunged into surgical menopause after having their ovaries removed were unable to be supported by their MPs. Mr. Danzebreg said it would be fabulous for every area to have a physical women's health hub, but is unlikely due to a lack of funding and healthcare professionals. Many ICBs have developed a hub and spoke model where there is a centralized location that provides more specialist service, such as a hospital, which is linked to a network of local spokes, such as GP surgeries or local venues. I really say I do like this idea of these women health hubs. I like that they've been pushing along with it. I actually think, I don't know, I'm assuming that Labour's position is to continue with it, and that every single place has one, because I do think that it's important. We talk about how important it is for women to have their spaces, and I really do think that, when it comes to this sensitive stuff, of course they have that with a female doctor, and rightly so, but just have an actual place for them. I think it does help as well, help in terms of, from mentally and physically point of view, as well as just dealing with that healthcare. Other models include a virtual hub, travelling clinicians, or a pop-up service, and many ICBs have chosen a mixed model to develop their offering in a tailored way. NHS North East London as ICB has developed an effective women's health hub model with 4 hubs covered in different areas and offering self-referrals and support for all common. That's very good. Gynaecological conditions. That's very good. There are 2 women's health hubs in NHS Greater Manchester ICB, and at least one locally is expected to offer all 8 core services by December 2024, by the end, which is with the new year. NHS Humber and North Yorkshire ICB said it has 6 hubs, while NHS Coventry and Warwickshire ICB said it has 5, and NHS North East and North Cumbria ICB has 3. Dr. Raki Taker, President of the Royal College of Orchestrations and Gynaecologists, the RCOG, said despite recent evaluations showing their promise and potential, progress towards implementing a women's health hub in all integrated care systems in England has been frustratingly slow. We know that accessing basic core is often challenging for women, who find themselves bounce back and forth between GP surgery, sexual health clinics and hospitals to access the care they need. Yeah, that needs to stop. Hubs are a essential solution to addressing this by better integrating primary, secondary and sexual health services. Scaling up and developing the model consistently across the country will also play an important role in addressing health inequalities. Yeah, 100%. He said that a women's health hub does not necessarily involve a new building or physical space. They should build on and integrate existing services and to allow healthcare professionals from different parts of the system to work more closely together. Dr. Sue Mann, NHS England's National Clinical Director for Women's Health, has said, all too often we've heard from women whose health concerns have been dismissed. And that's why NHS has taken firm action to improve service, including ensuring that over 8 in 10 local services have at least one women's health hub providing 2 or more core services such as menopause assessment, screening or contraceptive counselling. These community hubs are already improving access to high quality specialist care for thousands of women outside of hospitals, and local areas will continue to roll out services to ensure women have equal access to care across the country. My hope is that it continues that, and I think it's really obviously, it makes sense that to have the services more integrated, more closer together for them, rather than having to go from one place to another to get that help they need for the next step of their process or whatever that may be. It's a drag. It's a really drag on people. It's a drag on women for them to have to do that. Where you have it all in one central place and you constantly keep going back to the same place, it's a bit more comforting in doing so. We talk about mental health. That's a mental barrier for women too. Having to go to one place and then told the next day you have to go to another place, or on the same day if you need to go to another. Like that's it's frustrating. It's frustrating. It's a lot frustrating. Then you got if you're going by public transport, it might not always go well. You're getting a lift there and back, and it's just like, or you're driving there, and it's just like, oh, your car park, you got to pay for the car park, or you can't find a parking space. And all these things, they just play on your mind, and it's. Whereas if it's all in one place, it makes it easier for them to get everything that they need in the one place. And especially, like we say, if it's always the same doctors, if it's the same person helping you as well, it's also a big thing as well. So, you know, I'm all for this. It's a shame that it hasn't fully gone through all the things, but the fact that progress has been made on it is a good sign. It is a good sign that there has been progress made on this, and I think that is warranted. That not everyone has done it exactly like that and have done it differently, but I would say, you know, we obviously like to see at the end of the year, the end of 2025, that women's health has improved as a direct result of actions being taken by all these local authorities in these regions when it comes to women's health. But what do you guys honestly think about women's health hubs? What do you guys think about the work that they've done? Maybe some of you may have had experience or know of people who've had experience in NHS England. If you can, please share them down in the comment section below what you guys think of them. If you found this video interesting and informative, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. And if you want to go one step further and financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.